Christine, thank you. Joining me now to answer your questions you may have is Dr. Brandi Freeman. She's the assistant professor of pediatrics at the University of Colorado School of Medicine. Dr. Brandi, it's a pleasure to have you here. So let's jump right in. What are the major differences between the vaccine for adults and now children? What makes this dose safe for kids?
Right. No, thank you so much for having me. So I think the key difference is the kind of dilution or amount of vaccine that's going to be given to a child. So the child dose for the 5 to 11-year-olds is 1/3 of the dose of the adult vaccine. Why do we know it's safe for children? I think the studies, the research is good. There was a conscientious effort to make sure that children from minority communities were represented in these trials. It's safe for them, confident in giving this vaccine.
Dr. Freeman, talk about the needle size. I mean, these are little people. Are they using the same needles they would use for you and I, or is it a smaller needle?
It is a smaller needle, it's shorter. So definitely recognizing, the muscle mass, the weight differences, the just overall size differences that children have from adults. There were changes made to this vaccine for the 5 to 11-year-olds to make sure that it would be able to get where we need it to get in their muscle and could do it safely.
All right, Dr. Friedman, my last question for you, unfortunately. What do you say to parents who want to wait to vaccinate their kids? What do you say to them?
So, one, I try to have a conversation. I think understanding their reasons for wanting to wait, understanding that rationale. I've had this conversation with many friends actually in the last week, talking about their concerns and the newness of the vaccine. I think we do know the science is good, it is safe for children. There are risks in waiting in terms of actually contracting the COVID-19 virus. So I do encourage all of my parents, all of my friends, my family to get this vaccine as soon as they feel comfortable.
God, it sounds like the benefits outweigh the risk at this point, right?
Definitely.
Dr. Brandi Freeman, thank you so much for joining us. And BNC Live will be right back.